Let's bring in CNN's Dr. Sanjay Gupta joining me now. And Sanjay, an internal memo from Michigan hospital system's been getting a lot of attention. It details, and the hospital has confirmed it's real, it details how in a worst case scenario, they are preparing protocols for life and death decisions that might have to be made during an emergency. Who gets a ventilator, who does not? How long does somebody get to stay on a ventilator? Part of the letter says, to quote from it, quote, "Some patients will be extremely sick and very unlikely to survive their illness. Even with critical treatment, treating the patients would take away resources for patients who might survive." Now, I should underline that the Henry Ford Health System told CNN that none of their hospitals are anywhere near having to enact such protocols. None of them are at capacity with coronavirus patients. But I mean, we've seen what happened in Italy, and the U.S. has been following Italy by about 10 or 11 days. It could happen. I mean, we need to be honest about that.
Yeah, look, I think we do have to be honest about that. And I can tell you, Jake, first of all, Michigan's my home state. I know many of the doctors there. I've been speaking to some of them off the record on Background today. And, you know, a couple things really struck me. One is that, as you point out, this is a real letter. They all knew about this. They all knew that this letter was being circulated. And there was no degree of surprise by this at all when I talked to these physicians. You know, based on what they're seeing and the projections that they're hearing, when you hear a doubling rate that happens every couple of days, the numbers double every couple of days. I mean, it goes, you know, that's exponential growth. So you really can't sit here and at any point really in Michigan or many of these places around the country and say things look okay for now. That you just can't think that way. I think when the numbers are growing that quickly, so they are talking about this. Many physician groups are talking about this. These are real conversations that are happening in the country right now. It is challenging, obviously, because a lot of people who, especially those not in the healthcare profession, are hearing about rationing decisions, which is what this is. They're hearing about rationing decisions up front in a way that they've never probably ever heard before. And it's jarring, I admit it, but it's real, Jake. And not just there, but in many hospital systems.
Yeah, and I've seen some people criticize members of the media for even covering this, covering it as if we're fear mongering. It's very clear we're not at that point, but it's also clear other Western countries like Italy have reached that point. I want you to take a listen to the mayor of Detroit, Mike Duggan. He applauded the approach and the forthrightness of this healthcare system talking about a worst case scenario.
Henry Ford is one of America's great healthcare systems, and what they put out was honest. We're trying to bend the curve. The governor of the state has put a shelter-in-place order in, and where everybody is doing everything we can to stop it. But you would be irresponsible as a healthcare system CEO if you weren't planning for that eventuality.
Do you agree, and do you think most hospital systems and hospitals have plans like this in place, whether or not they acknowledge it publicly?
Yes, I think most hospital systems do have plans in place, and I can tell you that, you know, that's what I've been doing, is spending a lot of time talking to people in various places around the country to really get a sense of how things stand. And you do hear about this. In fact, Jake, in the New England Journal of Medicine this week, there was an article. This is a journal that many people in the medical community read, and they basically talked specifically about what might rationing look like. Should there be independent committees that are set up in a hospital, for example, so that the treating physicians and nurses don't have to be the ones that are, you know, there can be an independent body helping make these decisions. I mean, these are real discussions happening. And Jake, look, of course, no one wants or hopes that this will happen, but this is the sort of preparation that has to take place, because all of a sudden, if people are confronted with it and they have no sort of plan or idea or sort of way of thinking through this, that's tough on everybody as well. It's tough no matter what, but that makes it even tougher.
And Sanjay, you and I have been yelling this now for weeks and weeks, if not months at this point. The hospitals do not have what they need. They don't have the personal protective equipment. They don't have the ventilators. Now, in terms of the PPE, according to the Italian Association of Doctors, 51 Italian doctors who tested positive for coronavirus have now died. That's a lot of people to die, and that's a huge shock to the healthcare system.
Look, I mean, this was tragic. I saw that alert come across 51 physicians, 32 of them in this northern area. I mean, these are entire communities of medical professionals that are whose lives are being lost right now. It's really sad, Jake. I think that this idea that people have been screaming, the Italian Medical Federation screaming as well for some time that they needed more PPE, this wasn't a precaution. It's protective equipment, but it was essential. And I think, just as many countries around the world did not pay attention to Italy, you hear from people in Spain that I've been talking to, yeah, we thought that it was over there, it's not really going to come here. They were watching what happens in Italy, and still some of the same precautions were not being taken. What happened to these doctors, 51 doctors who've now passed, 32 in just the northern region of Italy alone. I mean, everyone should listen to this because we can learn a lesson, we can better prepare. It was not just precautionary sort of principles, it was essential principles. And it's also a reminder that in healthcare settings, in hospitals, that's where people are most likely to get sick. The virus is clearly circulating even more robustly there. You can't keep safe distance away from each other. The patients are aerosolizing, more likely to aerosolize the virus in those settings. So we've got to pay attention to this. And look, I know that there's places around the country where they say, yeah, so far we're good. We have enough PPE right now. The numbers are doubling every couple of days, Jake. Their hospital systems have gone through months worth of their PPE in just weeks. So they really need it. And we should heed the lesson from Italy.
So, and lastly, Sanjay, it's been made very clear by not only Dr. Fauci, but even Vice President Pence that this goal of opening up America so the church pews can be crowded in Easter, which is just 2 weeks and a couple days away, that's aspirational, which is another nice way of saying President Trump's push for that that's what he wants to happen, but we're not going to be able to do that and also save lives. When do you think there will be at least some ability for the nation to think about a return to normalcy?
Well, I've asked just about everybody that question, including Fauci, including Bill Gates last night. I've talked to various hospital systems. You probably saw Governor DeWine in Ohio, who was very aggressive early on, closing Ohio State University early. People thought, what are you doing? He did that very early, and he even is saying, look, it's looking like, maybe end of April, May. Nobody knows for sure. We don't know exactly where we are on that curve. I think if we see a few days where that doubling number starts to come down, that's going to be a good sign, sort of saying that we've gotten close to the peak. But, I think, most people are saying that the entire cycle is probably 8 to 10 weeks. So the peak, maybe, 4 or so, 5 weeks into this.